Well, consultant family physician, Vice President of Medical Initiative for Africa, Dr. Agbor Ebuta, joins me via Skype from Abuja for more on this development. Thank you very much for joining us at this point. Now, I'm sure you might have heard about the National Health Insurance Scheme that the President has signed into law. That was yesterday, though. What came to mind looking at the fact that this is to repeal the earlier one that was signed into law years ago? What do you think about this?
Well, I think it's exciting times for the healthcare industry in Nigeria, especially at a time where we are experiencing a significant percentage of our colleagues living in a drove of brain drain situation. So critically, it's a significant addition. Both qualitatively and quantitatively, the new act makes a huge difference in the situation. For example, the old act, if you go back to the old act of 1999, you had just about 9 functions clearly stated out for the National Health Insurance Scheme, but the new authority has about 26 functions. That is a significant quantitative leap of about 200%. But if you now look at the quality of the functions that have now been added, it says a lot that the team that put together these acts did a good job. For example, we are looking at mandatory coverage of all Nigerians, no single one left, 200 million Nigerians, and coverage of also legal residents of Nigeria. Apart from that, it's going to be giving teeth. This new act is going to be giving teeth and bite to the National Health Act of 2014 rather, which talked about the Basic Healthcare Provision Fund. That is a fund that is supposed to revolutionize the Nigerian health sector, but has not been implemented. So what this new act will do is that 1% of the consolidated revenue of the federal government. I mean, just imagine it. It means that 1% of everything that the federal government earns, except other deductions as required by other acts, in addition to some money that would come in from international donors and high net worth individuals like the billionaires who formed COVAX not too long ago, that would increase the pool of resources. It would also make sure that everybody who is a Nigerian would be given a National Health Authority Act, Insurance Authority Act card, and will be eligible to basic health care. It will mean that primary health care center.
One thing before we let you go now, looking at all of this now, a lot of people are concerned about the implementation of the recommendations of the new act and the state of government-owned facilities, medical facilities. How do we marry both? First of all, we are looking at implementation of this and the equipment that we have in government hospitals to cater for the healthcare needs of over 83 million people.
Excellent question. The point is that this act is going to cover 200 million people. The 83 million people are supposed to be people who cannot afford to pay for premium.
Yeah.
In terms of funding, it will revolutionize funding. Presently, we are doing less than 5% of our gross national budget to fund health. The Abuja Declaration of 2000 recommended 15%. What this act will do will be that it will increase the pool of funds that is available for health. Mm-hmm. That alone is something. The second aspect of it is that we will have more money to fund primary health care. It means that we have about 19,000 primary healthcare centers on paper, but less than 50% of those primary healthcare centers are active. And remember, those primary healthcare centers do not have any direct relationship with the National Health Insurance Program. Mm-hmm. But this act places them at the center of it. In fact, it will surprise you, it shouldn't surprise you to know that most of the funds that are available for the basic healthcare provision funds, which will run into billions, if not careful, trillions, will go directly to fund primary healthcare human resource training, primary healthcare equipment supply and maintenance, primary healthcare essential drug, vaccine and consumables, and primary healthcare infrastructure. So what we would have now is that we have more funds written in black and white in our constitution that is supposed to go to the primary healthcare center. But like all things, we must also place the governance. You raised a very valid question. What is going to happen? That amount of money, we must place the right governance in place. We must put checks and balances to avoid fraud. We must put checks and balances to make sure that people are not going to lift this money for their personal gains. But the Act has also covered that. The Act talked about what you call the deployment of ICT, the use of BVN, National Management Agency certifications and biometrics to capture people. So once you deploy that, it means that everybody who has a card will be tracked. Once you have that in place, you can talk about monitoring and evaluation, and anybody who takes 1 naira from that phone, I think the federal government should be able to track him and pay and make him pay for whatever infractions have happened.
All right, a consultant family physician, Vice President of Medical Initiative for Africa, Dr. Agbor Ebuta, thank you very much for talking to us.
It's a pleasure. Thank you.